All right, so for this week, we're revisiting treatments for androgenic alopecia or male pattern hair loss. And I wanted to recap just a couple things, build a little bit on the mechanistic kind of stuff that I found, and then go into some more clinical trials that we talked about. So the first part of this is, remember, the real culprit in all of this is DHT. DHT is a derivative of testosterone. So cholesterol is used to make testosterone. This is happening in the testes. That testosterone is released into the blood, and it travels throughout the body to individual cells. Those individual cells, including the ones in a hair follicle, have an enzyme, 5-alpha reductase, which converts testosterone into DHT. And that's our real issue, because remember, DHT does its thing by binding to androgen receptors. And recall that that DHT binds the same exact androgen receptor that testosterone does. So in the image, they're showing DHT as these little bluish purple circles that are binding androgen receptors and activating them. The testosterone itself very easily could also bind to androgen receptor, but it has significantly lower affinity. So the DHT just binds with about 5x the strength that testosterone does, but the end effect is the same. Androgen receptor gets activated, translocates to the nucleus. So when it's inactive, it's waiting out here in the cytoplasm. Once it binds either DHT or testosterone, it can now enter the nucleus, bind response elements and genes, which really just mean regions of the genome that control whether genes are turned on or turned off. And in the end, the genes that are turned on, right, we make mRNA copies of those genes. That leads to copies of the proteins that those genes code for. And then those proteins have all sorts of functions. It turns out that no one really seems all that certain why DHT and activating these genes decreases hair density. All that's really known for sure is that when androgen receptor is turned on at high levels, in a lot of men, somewhat based on their genetics, the hair follicle miniaturizes, which basically just means it starts shrinking over and over until it gets so small that it basically can't produce hair anymore and it goes dormant. And so when we reduce DHT levels by blocking 5-alpha reductase, you're not really creating new hair follicles. You're just reactivating hair follicles that used to be functional and aren't right now. Right? So a few different ways that we can do this. We briefly talked about this last week, I think, during our meeting, but I wanted to add it in here since it's one of the sort of key ideas that we're going through. Is you've got these two different drugs that can block 5-alpha reductase. Finasteride, which is by far the more popular drug because it's been approved for a long time, and in the US anyway, it's approved specifically for hair loss. I figured this out in my digging. Remember, these drugs, finasteride and dutasteride, are used to also treat benign prostatic hyperplasia or overgrowth of the prostate gland. And dutasteride is approved by the FDA in the United States anyway for use for treating prostate growth. It is not officially approved for use for hair loss, but there are plenty of studies showing that dutasteride is effective. And so some doctors have been prescribing it off-label. That's a little bit controversial. But the mechanism here is finasteride very specifically inhibits type 2 5-alpha reductase, whereas dutasteride inhibits both type 1 and type 2 5-alpha reductase. And these two different variants, a word that you probably will see come up at some point, we call these isoforms, which is really just a way of saying variants. They're enzymes that carry out the same reaction in general, but they have slightly different structures and often slightly different tissue expression patterns. So you might see, one isoform specifically in the brain, or another one in the kidney, or one in skeletal muscle. And there are some genes that have maybe 4, 5, 6, 7 isoforms that you'll see spread out all throughout the body. Some of them are even expressed at different ages, like gestationally or as an infant or adolescent or adult. And so the reason that dutasteride is more effective is it just lowers DHT levels even more than finasteride did. So not a different mechanism, nothing dramatically changed, just more potent, more broad spectrum. So we expect a further decrease in DHT. That should mean less activation of androgen receptor, which means less of transcription of these genes that lead to hair follicle shrinkage or miniaturization. And that's the end mechanism. And again, to recap, like we saw last time, there is good evidence from trials in humans that dutasteride is more effective than finasteride, especially for some particular types of hair loss anyway. And the right shift away from this incidence ratio of 1, if I remember, if our red circles were on the line that lined up with 1, that would mean that it just was no difference. Dutasteride, finasteride, same effect. We pretty consistently see movement to the right, and so significantly more effective. All right. Okay, one of the other things that we talked about is delivery method. So most drugs have a single delivery method. They're either oral or by injection, and there's a good reason for it. This is an interesting case where there are 2 different delivery routes that are often used, and those are topical, meaning rubbing it on the skin of the scalp itself, like where you want the hair regrowth to happen, as opposed to oral, where you just ingest the medication. And there are arguments on both sides. So the general idea is topical has the advantage of staying more localized. Right? If someone takes oral finasteride or dutasteride, it has the benefit of being delivered systemically, so you're sure it gets to all the hair follicles in the scalp, where you hope it will have its effect and reduce DHT levels. The only problem is it travels systemically through the entire body and is going to reduce DHT levels everywhere, right? Not just in hair follicles. And so the reason that people are even investigating the topical option is the oral medication has some side effects. Some men have reported fatigue or weight gain, or like unwanted sexual side effects because it's, DHT is a very potent activator of androgen receptor everywhere. So we want to know, does the topical version work as well as the oral version? Right. And so what they did is 3 separate groups, right? So they had an initial sample size of 458 people that were completely randomized into one of 3 groups. Topical finasteride, placebo, or oral finasteride. And they followed those people for 24 weeks, which was enough time to see some significant changes. And the end result of that was there really wasn't much of a difference. One thing about this that makes me a little bit suspicious, but it's nothing terrible, is they were measuring hair follicle density and putting it into a formula that basically spit out a quantifiable number. And baseline meaning week 0, so that's the start of the study before any treatment. And you can see that oral and topical finasteride, those are these 2 lines. At the 24-week target, they wind up indistinguishable between each other. There's no difference between the 2 statistically. Although the oral was very slightly higher, not a large enough sample size to say if it was statistically significant or not. They were both significantly different than the placebo, but what was a little bit odd to me is that the placebo ended up what looked like it was significantly higher than baseline, nowhere near to the degree that the actual treatments did. But what it makes me wonder is, was their error range really that high that they had that much of a bump over 24 weeks? Or it would be a bit difficult to imagine, but is there some sort of like psychological placebo effect that could stimulate hair growth? I really, really would doubt it, but those are the way the data came back. But I think the most important aspect of this is there's no detectable difference. Both drugs, oral versus topical, increased hair follicle growth, and that's exactly the goal that we were going after. The other interesting bit of information, they also compared those same three groups that we saw looking at hair follicle growth, and they compared serum DHT concentration, which means DHT levels in the blood, trying to ask the question if, well, first of all, do the oral medications decrease DHT in the blood? Almost certainly expect that to be yes. But does applying it directly to the skin also decrease blood levels? That really depends on how much of the drug is absorbed. And they were measuring this in nanograms per deciliter, and these numbers are showing changes from baseline over the 24-week period. So what was interesting is both medications, topical and oral, did decrease blood DHT levels, and that happened at some point within the first 4 weeks of treatment. So it was relatively quick, and then seemed to reach an equilibrium point and stay pretty stable. So that by the end of it, there was a 34%-ish reduction for topical finasteride and a 55% reduction for oral finasteride. This likely explains why the oral medication is more likely to have side effects. They didn't directly measure those side effects in the study, but it makes sense. Another thing to point out is the error bars on this are gigantic. So notice these green lines coming up out of the placebo, orange lines here, black lines. Those are error bars showing you that there is an enormous range, which means that some people at baseline had levels that were in the 60s, and other people at baseline probably had levels down here in the 20s. And part of this is just demonstrating that DHT isn't the whole story when it comes to androgens or sex hormones. The amount of testosterone itself matters too, and there's even some evidence that for people that are taking these drugs, that they might get an increase in free testosterone, and it really is just a matter of how much of it is still converted to DHT once it actually enters target cells. All right, so the topical seems to work just as effectively as oral, seems to have at least somewhat lower risk of causing systemic changes, and so there doesn't really seem like there's any reason to avoid topical finasteride. And I know in the U.S., while searching around, that both are available, so it seems like every patient gets to decide, which version they want. Okay, another interesting trial that I found, just because I found widely for sale in the U.S., the most popular formulation seems to be for hair loss treatment in the United States is actually a combination of two different drugs, minoxidil, which we haven't talked about yet, and finasteride in combination. And so I'll get to the mechanism in a little bit, but minoxidil works by a completely different mechanism than finasteride, and they're going to compare each of these drugs separately. That's the monotherapy. With the two in combination. So a 3-arm pilot trial, each drug on its own, and then the two in combination to see if they can have a combined effect at increasing hair growth. All right, so mechanism-wise, finasteride, remember, is blocking 5-alpha reductase, decreased DHT levels. Minoxidil, very, very different. When it's applied to the scalp and absorbed into the skin, it is, by enzymes throughout the body, converted into minoxidil sulfite, which is the actual active form. That drug binds to potassium channels, and in blood vessels, opening potassium channels acts as a vasodilator, so it increases blood flow. And so minoxidil does its thing by increasing blood flow around hair follicles, which is going to bring more nutrients, bring more oxygen, facilitate growth. And so the idea is if we can use these two drugs in combination, right, we can decrease expression of the genes that are miniaturizing the follicle, right? That's finasteride by decreasing DHT. Meanwhile, we can try to push more nutrients, more oxygen, more blood flow overall to those hair follicles using minoxidil. Hopefully they'll have a combinatoric effect where we get a better result when the two are merged. And it turned out that that was precisely what happened. So this is, they're being very precise in their measurements here. This is hair follicle density. So basically hairs per square centimeter. They basically, put the people that are in the trial in a chair and stabilize their head, and they use a camera at a very, very specific distance from the skin to measure exactly, 1 square centimeter. Do that multiple times, count the number of hairs, and they're defining the baseline as 0. That does not mean that the person was completely bald. They're just saying we're normalizing it to 0, and a negative number would be a decrease, and of course any positive number would be an increase. And so finasteride on its own gave some improvement. Minoxidil on its own gave some improvement that was actually slightly better. The two in combination is pretty incredible in that it seems to be even more than an additive effect, because if you look at these numbers, finasteride was somewhere in the ballpark of about 20, right, over on this axis, and minoxidil was around a 40. You would think, oh, add them together, maybe we'll get to 60. The combination actually got to 80, and so it seems like there's some sort of mechanism where the two feed each other, so the hair follicles that wouldn't have been brought back by either mechanism now have an even greater advantage. You get more hair growth by combining the two. And so it seems like there's good evidence for that the most popular version of a hair loss formula, again, at least in the US, is a combination of both of these drugs. Okay, last thing I wanted to do, because we talked about it a little bit, is the effectiveness of using light, specifically infrared light, for androgenic alopecia, which is, again, just fancy speak for male pattern hair loss. And so what they did is they were comparing 1565 is just a very specific wavelength of infrared light. They were using laser therapy to deliver that particular wavelength of light to the scalp, and compared it to minoxidil for treatment. In looking into this a little bit more, I realized pretty quickly that there is not an enormous amount of research on this topic, and so I had a hard time finding high-quality papers with decent sample sizes. So just as a caveat, this paper, their sample size was only, I believe, 15 individuals per group. So 15 on minoxidil, 15 on the light therapy. And so take it with a little bit of a grain of salt. That's about the best we've been able to get. I don't know why there aren't larger sample sizes, because it's not all that difficult to do. But they only did this for 10 weeks as well, which is not an enormous amount of time. Most papers that I see suggest that it takes more like 20 to 30 weeks to start seeing really significant results. But they have statistics and a handful of significant p-values. So the laser group, this is right baseline to week 10 for laser therapy and minoxidil. And then this is the actual change, right? So if we're looking at hair count, meaning like number of total hairs counted, we seem to get a better increase for that, and you can measure it as hair density, right? Better results for the laser therapy compared to minoxidil. P-value was significant. All of these other things are, very, very detailed things that they measured about the actual stage of hair follicle growth that we're in. But the first two, total number and density, are obviously what people really care about. So it seemed like there was an increase. 10 weeks, I'm a little bit skeptical, just because, right, we saw here, this was at 3 months, and the numbers kept going up significantly from month 3 to month 6. 3 months would be about 12 weeks, so they would be maybe out in here somewhere at 10 weeks. I wish they would have let it run longer, because the minoxidil seems like it almost certainly would have kept increasing, and the laser therapy, who knows, because no one's ever tried it. What would be really interesting next is to see someone do a combination of the two where they use, or really all three, minoxidil plus finasteride, or dutasteride for that matter, plus the laser therapy, and see if you can get an even further amplified effect with greater results. And I'm guessing it won't take too much longer for somebody to get that idea and carry it out as soon as they can get funding for a trial. All right, as always, hope it was interesting, and I will talk to you more soon.